Hello viewers, this is Dr. Isatu Kakay-Diallo from Sarah Network Health Talk and Discoveries. Today I want to start by saying that I hope you've had the opportunity to look at the previous videos that has to do with hypertension, traumatic brain injury, stroke, COVID-19 guidelines, and all the other discoveries that we have uploaded on YouTube. If you haven't subscribed yet, please do so by subscribing with the red button. Make sure you share, comment, give suggestions and feedback, because whatever feedback you give, we will try to implement that. And today, Miss Alon Fambude, this is not Dr. Isatu Kakay-Diallo. They come to you today again with another health talk we get for deal with we people that more they travel now Sierra Leone. So as I bring this to you, I hope you don't listen to the hypertension video, the stroke video, the traumatic brain injury video, as well as the COVID-19 guidelines measures them. Today, what we want to talk about really, we want to talk about the health promotion and prevention as to what we could do for prevent ourselves from some illnesses that will travel now other country. That means, by vaccination, where you did what you need for do, and things like that. So again, going back to the English language, what I'm saying is, this is important for people traveling overseas, especially when you're traveling to Sierra Leone. What are some of the things that you should do to prevent and protect yourself from getting sick? And you can do that through vaccination, following simple, basic, life measures, that will be ideal for you to do, especially when you're traveling out of the country, whether it's, Sierra Leone or any other part of the African nation, as well as other, countries that require vaccination. And we want to start by, talking about, first, hand hygiene. Always hand hygiene. It's the simple, most effective way in order for you to prevent infection. Right? Just like how we say with COVID-19, wash your hands, wear your mask, social distancing. So you see, hand washing is always going to be there, right? So if you don't have clean water to do that, and with soap and water, with warm water, you definitely want to use an alcohol-based hand sanitizer. Doing that, you definitely will prevent so many different infections that you come in contact with. Just think about it. Like if you're going into a vehicle, somebody already used that, like especially something that is not yours, even if it's yours, right? Somebody, you've opened the door, you've touched it, and then now you're about to eat or you're about to do something that goes through your mouth. You have to wash your hands. So these are like the basic steps in preventing infection. So also, another thing you want to think about, cough hygiene, right? So you want to use the elbow, the inner elbow, like when you're trying to cough, this is how you want to cough, right? Like you don't want to cough, in the air, and then when you do that, what happens? Everything goes, into the space. And then somebody who's standing next to you can inhale that and will get sick, depending on what type of illnesses they have. We're not saying they are infectious, because you don't know until they start presenting with symptoms, but you practicing that and the other person practicing cough hygiene, when you sneeze, when you cough, definitely you can protect yourself and other people around you, right? So that's something that we should remember. Use a tissue, or and also when you use a tissue, when you cough in it or when you sneeze, make sure you fold it or wrap it, put it in a dustbin, so that it's not just left in the air, because some illnesses are airborne, which we're going to get into briefly, right? So as that's one thing we should do, you wash your hands right after that. And if you're in a place where there's no soap and water, definitely use a hand sanitizer. And then again, you want to speak up to prevent infection by letting people know, you need to wash your hands before you eat, before you touch any food, with soap and clean water, right? Using alcohol-based hand sanitizer, 3 to 5 times after using it, definitely wash your hands with soap and water. Because, then it might not be just effective. You're just putting more dirt on top of whatever you've used before, right? So washing your hands after that time would really feel better, because sometimes think about it, when you use it, your hands feel sticky, right? It feels sticky. So also remind caregivers and other people them, to other people to clean their hands, right? And if they're taking care of, things that's body fluid, wearing gloves to protect themselves is definitely ideal and way of preventing infections and the spread of contamination from one person to the other. Vaccination is another way, right? So when you're traveling, make sure you have a traveling kit, supplies. This would include like first aid, over-the-counter medications, or you should have thermometer to check temperature, especially when you're traveling with kids, right? Children, tissue, hand sanitizer, insect repellent, because like some places there are mosquitoes that can bite you, so you don't want those mosquitoes to bite you and then causes, if it's one of those infected ones, can cause you to have malaria, right? And then we'll talk about that a little bit later on to the program. So sunscreen, if you're going to be out, people that love to go to the beach, like want to get tan, definitely sunscreen, because it's going to prevent you from getting skin cancer, sunburn, and all these different things, right? Also, make sure that you watch the water supply that you are using. Bed net, if where you're going is required, definitely you can use that. It's another way of protecting yourself from mosquito bites. Immunization when traveling to Sierra Leone and other part of West Africa, go to the cdc.gov and then select travelers health, select your destination, then you enter your destination that you're going to. So this is just a step to follow, a simple step to follow, so that you can really get these guidelines for yourself and your family members if you're traveling with them overseas. And then all recommendations for all travelers, you should be up to date with your routine vaccination while traveling to any destination. Because, even people going to other part of, the Eastern Europe, or, like other countries that Asia, they require you to get certain vaccine. Why is that? They want you to be protected. They also want their people in the country to be protected. Same goes for Sierra Leone. We want people to come in healthy so that, our people will stay safe, right? Because they're already used to the climate there, the things that are going on, and then they want you that are coming, or you and your family members that are coming to visit are also healthy, to stay in the country. So routine vaccine, make sure that, again, the children that you're traveling with or yourself have either the measles, you should have measles, mumps, rubella, which is called the MMR vaccine, the tetanus vaccine, which is good for 10 years, the varicella vaccine, if you have not been exposed, meaning when you were a child or when you were younger, you got sick with chickenpox, then you build a immunity through that. But that's years ago. Now people getting vaccine, children are being vaccinated with the varicella or the chickenpox vaccine. Polio and your yearly flu vaccine is important, so that you can protect yourself and protect the children. And then, the measles. Why is it important for you to get a measles vaccine? It is a virus that spreads through the air by a respiratory droplet that produces, by coughing, sneezing. That's why we think cough hygiene, covering your cough with the inner part of your elbow is important. Or, if you have a jacket on, do it in there so that it doesn't spread out. And then make sure you wash your hands. That's very important. And if you come in contact with this person's saliva that have measles, the virus, what would happen? You start developing rash about 3 to 5 days. You start sneezing or could get runny nose. The fever is going to go up to 104 degrees Fahrenheit. The person will start coughing. They will have pink eye, diarrhea, headache. The coccyx part, which is like inside the mouth. They don't see that with every type of viruses, right? So that's like one way to identify this particular virus. Sore throat, swelling of the lymph nodes, right? When there's an infection, virus, or cancer, the lymph nodes react to these things. That, something is in my body. Why is that? What should I do to protect it? So that's important for you to do. right? So when you see these things, you take the baby or the child or the person to their pediatrician so they could be evaluated and then start them on treatment. Measles could lead to a brain damage, so that's very serious. You have your baby or you have your child, they have no problem, all of a sudden they have a measles because they didn't get their vaccine. So now you've seen that this child is having a brain damage. That's going to be very sad and disappointing, that, you know what, I could have prevented this. And through which way? The key is vaccination. What they can do for this child when they are hospitalized is give them analgesics like Tylenol, ibuprofen, vitamin A may be helpful, but the key would be the MMR vaccine, which is given 12 months through 15 months. Then at the age of 4 to 6 years, they will get their second dose. But the only thing here, it has to be 28 days apart. That is if like the child is being vaccinated on a catch-up schedule, right? Meaning they didn't get it at the age of 12 months to 15 months, they're getting it later, and then, or maybe closer to the 4-year mark. It has to be separated by 28 days. So that's very important. Then let's dive into the next concern when you're traveling overseas. Yellow fever, a disease that is caused by virus that is spread through mosquito bites, right? So the symptoms tend to take 3 to 6 days to develop and include fever, chills, headache, backache, and muscle ache. About 15% of people who get yellow fever develop serious illnesses that can lead to bleeding, shock, organ failure, sometimes death, right? Sometimes they might die from it because it depending on the severity of this particular health condition. So again, when you're traveling overseas countries, there are many West African countries require you to have the yellow fever vaccine. The proof of vaccine is not valid usually. Let's say you're going to travel tomorrow, you take the vaccine and get your card. It's really not valid until 10 days after you get the vaccine. So try to get it before the 10 days of your trip, right? And then by that, you're protecting yourself, by getting, yellow fever, and then, it is a vaccine preventable illness, right? Preventing mosquito bites as well. There are the other measures that you can use, the repellents and so forth. The bed nets, again, is another one. So the vaccine is good for 10 years. So it required for arriving travelers from all countries, especially, when you're coming from overseas, you're coming to West Africa, it's required. It's recommended for travelers ages 9 months and older. So the child has to be at least 9 months for them to get that vaccine. Traveling with children, the vaccine should not be given to children younger than 6 months old, and only with caution to children that are in the range of 6 months to 8 months, right? So you have to do that with caution. So it will be best if you're giving these vaccines, try to really do it at 9 months. But if you need to give it around 6 to 9 months, make sure it's done with caution. I'm sure the clinicians will do that. You should receive this vaccine, like I said, 10 days prior to your trip, and then they're going to give you a card that is called a yellow fever card or international certificate of vaccination or prophylaxis, right? So bring this with you, take a picture of it so that they know you got your vaccine, so nobody stops you and say you need to do this and do that, right? And the vaccine lasts for life for most people. It lasts for life, but for some people after 10 years they may require a booster, right? So definitely go to the CDC.gov, to see the vaccine for yellow fever and whether you require a booster. Again, it's available in the United States, but it is currently limited. Okay, if you need the vaccine before your trip, definitely go to the CDC.gov, click on the nearest location where you could get the vaccine. But let me tell you this, I tried to get a booster because I was vaccinated with yellow fever, and I was told that they don't really have it. They were doing some of them that were for clinical trials. So I didn't feel comfortable taking that. So definitely try to search that and hope that you could get that vaccine. And then let's talk about malaria, which is also a disease that is spread through mosquito bites, right? And malaria can affect your liver and your red blood cells. Remember, we've talked about the liver and the hepatitis, so what the liver does and all these different things. So now if you have malaria that now infects your liver and your red blood cells, the symptoms that you would start presenting around 7 to 30 days. But these symptoms, remember, it can take up to 1 year to develop, right? Up to 1 year, because it all depends on the person's immunity and how rapidly the malaria, parasite is growing in your system. Symptoms would include high fevers, shaking, chills, and flu-like illnesses, which is like the body ache, cough, chill, dehydration, fatigue, fever, sweating, runny nose, congestion, headaches, sore throat, and loss of appetite. These are symptoms that you will present with. You may not have good appetite at all. Without treatment, malaria can cause severe illnesses and even death can occur, right? So just take a look at, these things and know that it's important when you're traveling overseas to check out, really what can be done in order to prevent yourself from malaria. So there are medications that you can take, right, which you take like 2 weeks before you travel, and also when you are there every week, and also when you come back, you have to take it for additional 2 weeks, like the mefloquine, which I take when I travel to Sierra Leone. So it's one that you take, it's a weekly tablet for myself, my children. These are things that I take. And malaria, again, it is seen, it's like a parasite that first damage the infected red blood cell, right? So directly, and then it initiates a chain, right? Which is like of a non-specific inflammatory process, and later on immunological responses by aggravating further inflammatory reaction can happen. Meaning inflammation means swelling, right? So the simple term, swelling, right? So because of the interdependence in the nature of these changes, as suggested, by the Margaret in 1997, 1977, it is usually difficult to clearly identify these three mechanisms, right? So the pathophysiology, it's there, but we all know that, malaria is being caused by you being infected with parasites and infected, red blood cells, and affecting your liver. And then, and it is usually said that, it's caused by a female mosquito. You will need to take prescription, as we stated, before, during, and after your trip, you need to take your anti-malaria medication, right? So your doctor can help you decide which medicine is right for you, because sometimes these medications can affect your liver, your kidneys. So maybe it's not the right type. Maybe I'm saying mefloquine now. Not everybody can take mefloquine. So they would have to do it based on what the clinical findings or your blood work are showing, whether you should take these type of medication or anti-malaria medication. So traveling with children, definitely ask the doctor for the best medicine to prevent malaria in children. And then, malaria treatment and prevention, again, we know mefloquine, chloroquine, quinine, primaquine, all the different quines, and doxycycline is another one. There is tafenoquine, these are also treatment that can be taken as well, right? So bed nets, repellent spray are ways of preventing yourself from, malaria. In rare cases, the yellow fever vaccine can have serious and sometimes fatal side effects. So I wanted to bring that up. People that are older, 60 years and older, with weakened immune system might be at higher risk of developing, these side effects. Also, there are special concerns for pregnant and nursing women that are breastfeeding. Talk to your doctor about whether they should get the vaccine for yellow fever. And then again, like when you buy in the repellent or these sprays, make sure it has the ingredient DEET, right? The product should contain that. That includes off, for example, oil of lemon, OLE. So these are other things that you can look for in the ingredient, whether this is the good one or the right one for you to use. And another one is IR 3535. It's just the ingredient. These are the things that you should look for when you're buying these repellents. Make sure you cover exposed skin, like people that like to go hiking, in the bushes. Make sure you're wearing long sleeve shirts, long pants and hats, in ways of how you can help to prevent yourself from mosquito bites, right? And also having the first aid kit. There's another thing that you can use, when you're trying to sleep, like stay and sleep in a screened and or air-conditioned room, so that way the mosquito will not bite you. Avoid scratching the mosquito bite, because what can happen, you would open up a wound, and now that wound might be infected. And that's why sometimes when you're traveling, you are required to get anti-prophylactic, whether it's topical antibiotics, with you, part of your first aid kit, right? And then, so sometimes the clothings need to be washed in a washer, with high humidity dryer, to get rid of these infected, maybe your clothes when you are in the bushes, you had something that climbed on it, and then you don't want to keep that in the house, right? The mosquito can still bite and live in there. So use the permethrin to treat the clothes and the gears that you're wearing, like the boots, the pants, the socks, any tents. So that definitely should be helpful, especially when you like to go hiking, people that like to go into the parks and things like that. Again, the other thing I want to talk about, it's the tuberculosis, vaccine. It's not a vaccine really. Tuberculosis, a PPD, which is a purified derivative, or they call this one, Mantoux tests, like a different skin test that they doing, for you to see whether you've been exposed to tuberculosis. So before you travel, you are required, really, or it's suggested and recommended that you get tested for tuberculosis. Either you do the blood test or you do the skin test. So they do a skin testing, you have to come in, 48 to 72 hours to make sure you're not positive. And if it is positive, they do a chest x-ray to make sure you don't have active TB. Or if you do the blood test can also show whether it's positive or negative, which is quantiferon. So it's either you do the PPD or you do the quantiferon, right? Then it shows whether you are exposed or whether you have an infection, can be validated by doing a chest x-ray. If the chest x-ray shows that you don't have TB, so then, you are cleared, but it's recommended, because you have that positive PPD or quantiferon, to take an isoniazid or INH prophylaxis for 6 to 12 months. While you're on this, they need to give you vitamin B6, because it causes, some neuropathy, right? B6 you would take, and also you can, which is a 50 milligram dosing. And also you take the blood test before, during, and after treatment. Why are you doing the blood test before, during, and after the treatment is to check your liver function. As we talk about the liver has a huge role to play, part of, detoxification, ensuring that we don't damage the liver and get rid of toxins. So that's important when you're on INH or isoniazid. So we've already talked about liver infection. So we just want you to go back and take a look at those videos when we talked about hepatitis, all the different types of hepatitis. And as we know already, hepatitis, how it's contracted, sexual contact, contaminated needles, blood products. So definitely getting the vaccine for hepatitis is very important in preventing yourself from hepatitis. And also the hepatitis A, which is caused by, food and contaminated water, definitely you want to be careful as you out there in Sierra Leone or other West African nation, or internationally to start with. I keep saying Sierra Leone because I'm from Sierra Leone. So I also, people that would love to go to Sierra Leone, I just want them to know that they should try to come there protected, prepared, and also know what to do when you're out there. How we also, as Sierra Leonean, wants you to feel about our country. We want you to be healthy when you're entering, getting the vaccines and all the different things that you do. So malaria, which is the big one, is always a serious disease and maybe deadly illness. So that's very important. If you become ill with fever, either while traveling in a malaria risk area or after you return home up to 1 year, you should seek medical attention and you should tell the doctor about your travel history. So that, as I mentioned, the symptoms start 7 to 30 days, but can last up to 1 year. So let's say you come back and then you still have symptoms, you definitely want to report that so they could check you for malaria and start treatment. Another problem that you want to think about when you're traveling is typhoid. Typhoid fever is a serious disease that's spread by contaminated food and water. Symptoms would last up to, would start coming around, days, that you're going to have like about high fever. You're going to have weakness, stomach pains, headache, and loss of appetite. These are serious symptoms for somebody to present with when you're on a trip or vacation that you don't want to have. So what can you do to prevent this? Sometimes, again, what I want to relate, patients or people can have constipation and some may have rash as well as internal bleeding, and that's why you see they may have that stomach pain or abdominal pain, and if you don't take prompt action, it can cause death, even though it's rare. It's rare, but death might occur with typhoid fever. And then for typhoid, you can get a typhoid through contaminated food and water in these countries that are at high risk. And then that include, Sierra Leone again. And the CDC recommends this vaccine for most travelers, especially if you are going to stay with friends and relatives, visiting similar cities or rural area, or if you are an adventurous person or like to eat everything, want to try everything, that's something they recommend that you get the vaccine. Traveling with children, injectable typhoid vaccine can be given to children 2 years and older. Oral typhoid vaccine can be given to children 6 years and older. And then typhoid vaccine is only 50 to 80% effective, so you should still be careful about what you eat and what you drink. And then what are some of the things that you want to eat? Food that you can eat. Eat food that are safe, they are cooked and served in hot areas so that the food is not cold. Hard-boiled eggs, fruits, and vegetables have to be washed in clean water and peeled by yourself, right? Pasteurized dairy products. And then what you should not eat: food that are served in room temperature or from street vendors, raw or soft cooked, which is like running eggs. You don't want to eat that. Raw or undercooked meat or fish, or rare, don't eat that. It's not good for you. And unwashed and or unpeeled raw fruits and vegetables, as well as peeling, fruits from or vegetables, keeping those for long, it's not good. So make sure it's you that doing that for yourself, right? So again, practice hand hygiene. Also the other things that you may want to look at is do's and don'ts, right? What you should not do. So definitely you want to drink bottled water that are sealed, carbonated, and they are safer. Water that been disinfected, meaning boiled, filtered, treated, is good. Ice made with bottled or disinfected water, bottled and sealed, carbonated, and sport drinks, hot coffee or tea, pasteurized milk. And then what you should not do: don't drink tap or well water, ice made with tap or well water, drink made with tap or well water. So these things, make sure the water is boiled at least, or it's a bottled water. I think that's the main key in terms of what to drink, right? And then, you know, if you feel sick and you think you have typhoid fever, talk to your doctor or your nurse. If you feel seriously ill, especially if you have fever, that's very concerning. You want to talk to your healthcare provider about where did you go to and how did you leave your trip, right? And avoid contact with other people while you are sick, because you don't want to get them sick either. Do not prepare or serve food to other people, especially when you are sick. Children and elderly, there's a recommendation, you know, for them to get the pneumonia vaccine, you know, and pneumonia depend on the age and health status, you know, people can have. PPD, to see if you have been exposed before you leave the country, and when you return, is important that you check, because I've also done that, you know, for my kids. Before we left, you know, the pediatrician recommended for them to have their PPD, and that was done. And also when we came back, they repeated it to make sure they were not exposed to TB, you know, tuberculosis, which is a bacterial infection of the lung. You know, skin test is a skin test or blood test called quantiferon, as I mentioned, you know. And also there are other vaccines that people can get, which is rabies, you know, is found in dogs, bats, and other mammals, you know, that, you know, not vaccinated. You know, the pets here, they tend to vaccinate them. You know, these are things that, you know, you want to look out for. And universal precaution, that is using barrier protection, covering any open wounds or sores before any proceedings, wearing gloves, you know, wearing masks, which we're doing right now with COVID-19, using caution, discard disinfected materials, and then clean area. Wash your hands, you know, throughout, and then also wash your clothes in hot water. Also, you know, the CDC universal precaution is, again, the gloves, the gowns, the aprons, mask, and protective eyewear. You know, current recommendation is to use surgical gowns and drapes. You know, these are barriers that you can use to protect yourself when needed. But when you're traveling, as long as you're washing your hands, using alcohol-based hand sanitizer, you know, following standard precautions, you know, and being vaccinated, I think you should be fine. And then the other thing here, which is being mainly for people, viewers here in the United States, which is called OSHA, is a mission with the Occupational Health Safety and Health Act of 1970, which Congress created this Occupational Safety and Health Administration to ensure that safe and healthful working conditions for working men and women by setting and enforcing standards and providing training, outreach, education, and assistance to people that work in the workforce. So this was done by, you know, President Richard Nixon, signed into law December 29, 1970. So for Miss Salon Fambodem, we don't talk beaucoup about we the travel and salon with for do, but the key thing then also we you really want to focus on now the malaria. We know say we get malaria in our country. If you begin get, you know, fever, you know, if you begin to get, you know, things them way you know right with you. We all know how malaria they make we feel, because I think that the biggest thing that they, you know, for we Sierra Leoneans them what we experience. Lord just knows, so we don't talk about the liver. What in the liver they do? So what when you get a malaria, because the mosquito don't bite you, it is spread through your liver and your red blood cells. When they happen, you begin get fever, meaning your body they warm, they begin shake, you know, you begin get, like say, back or you cough, you know, and then you know they get enough water in your body, they tire, you sweat, you know, when they cough self, you feel very tight, right? And also they get headache, you know, your throat back, they begin to feel like say something they, you know, scratch you, right? And your appetite not good. So we biggest thing is now for law use bed net. Law make sure say we use the measures that way, like I know say mosquito coil, because me self while in a salon I dey like mosquito coil. Or make sure say, you know, air condition, if you're not possible we go afford that day. Air condition day, where they sleep. If you go na them bush area, then make sure say you use the repellent when I like then spray that you put by your body. If you go to picking them again, make sure say the picking themselves wear long sleeve, you self wear long sleeve, and hats, long pants, because we in a bush, then thing I had can bet, and then we do that, it go na red blood cell and also your liver. The symptom them, the problem here, the symptoms then can start 7 to 30 days. 7 to 30 days, but it can last up to 1 year. Wait, last up to 1 year. Let's say you don't count the symptoms are not show, but what you want for do? You want for make sure say you make like your doctor know. I've been traveling in Africa, in my country, I think not been get this vaccine or this I not do. That way they then will check you for make sure say to malaria you get. Because if you get malaria then for 3 times, malaria can be very serious if you not treat them. If you not treat them, it can even cause possible loss in life, right? So we not want that. And again, where they out there, where they go, vaccine the way for take. If you make sure say you don't take yellow fever vaccine, because instead people then they get yellow fever because the mosquito don't bite them. The other thing again are typhoid fever when they get through contaminated water and food. So then they all nothing them will for watch. But what you can do for protect yourself, and we picking them will travel international, now any West African nation, including we own countries alone. I think we want to make sure so the water will they drink, the water clean, and then also the food them will they cook, the food them cook well, right? And also another problem for cooking in a salon will they cook well. So because sometimes this fever they last for a very long time, the person belly the heart, this not typhoid. They cause that then kind of problem, then they constipation, sometimes rash, and even if they make it they bleed, right? And if you not do nothing about them, people then can die in rare cases, but it can happen. So for prevent all this, law make sure say the water will they drink na clean drinking water. If you're not able to get bottled water, because now say say that the plastic water or the bottled water, make sure the water you boil them. You fruit then you wash them with soap and water, and then you peel and yourself you eat them. Nobody not for they do that for you, right? So because we don't talk all this per English, and I just want for talk and briefly overview. So when you go to salon, forget you yellow fever vaccine, which good for 10 years. Your tetanus is good for 10 years. The measles, because the measles is very serious for when people then get them, like they not really get treatment. The vaccine and will help you. And the typhoid bag get vaccine, so you want to make sure so you get the vaccine for yourself. And the picking them when they get the vaccine 2 years and older, the one with the injection with the give them, but if not by mouth, then for them 6 years and older, right? And then the other thing where you really want for the way they out there, make sure so you get temperature, you get first aid kit like some cortisone cream, some topical antibiotics them, and where they go you talk to your doctor for see if not the mefloquine, any of the chloroquine them you will take, or doxycycline, their medications they also can help. And also the mosquito net back, another one we will use, we will help you. So until then, I want for left and also today, if you get any questions, you get comments, please feel free let me know, and then we'll go address them on the next segment. And I will switch now from the English language, from the Creole to the English language. But before that, I just want to say, don't forget for, share this information, make sure you subscribe to the channel, and let know what else you want for Lord talk about. And to you, the listeners and the viewers, until we meet again, this is Dr. Isatu Kakay-Diallo. But with that, I want to end by saying, don't forget to share, don't forget to comment. Please feel free to subscribe to our channel and send us feedback as to what else would you like to discuss when it comes to your health. And today we end the topic about prevention, health promotion when you're traveling overseas, in how you can protect yourself, your loved one when you're out there. Thank you, and hope you stay safe.